Welcome to our next Futures Forum session. In order to understand the present, we must also understand the past. In this session, we hope to draw insights from the history of pandemic preparedness in two ways. We will debut Health Security Net, a first-of-its-kind online database that chronicles 25 years of pandemic preparedness policy. We will also have a more forward-leaning conversation about learning and accountability, how we can and should learn from COVID. To kick off this session, I'm pleased to introduce Dr. Victor Dzau, who is president of the National Academy of Medicine and a member of the WHO's Global Pandemic Monitoring Board. In his keynote address, Dr. Dzau will share a few reflections on key points we should be considering at this nexus of past efforts to measure preparedness and how to move forward from COVID, what we have learned, how we can do better, and the right questions to be asking. Dr. Dzau, over to you.
Thank you very much, Christopher. It's a great pleasure to be speaking, making some remarks on reflections on pandemic preparedness and response. I found the 23 nations study extremely exciting, with lots of really good caveats and the application of social sciences to learn about the individual nations' response and what are the common denominators and lessons learned. In this report, one of the most important pre-existing conditions that shape pandemic response has been solidarity, cohesion, and trust. Whether you come from an authoritarian top-down country or you come from a more idealistic democratic government. So I think that's really important, and I'm totally in agreement with that. Another precondition, however, is that once you have cohesion and trust and solidarity, you must have a plan. So I believe a national strategy, a plan that's clear, that can be coordinated and implemented is also really important. So that's the first point I want to make. Second point is, as you look at the 23 nations response and you learn about the variability, if you will, there still has to be a global collective response. Because it's been said, an outbreak anywhere means an outbreak everywhere. So how do we look at a global collective response? And those are the two areas I'm going to talk about today. Now, this first slide simply mentions that, in 2017, the UN Secretary General had a high-level task force after Ebola. And they recommended there should be an independent monitoring board. And therefore, the Global Preparedness Monitoring Board, gpmb, on which I serve, was created. It was co-convened by WHO and the World Bank. And we generated our first report in 2018. And I wonder if you can blow up the slides a little bit so I can see this, because I'm looking at my own image, but not seeing the slides. Technically, is it possible to actually bring the slide to my screen? All right. Well, let me just go ahead. I think it's important that this report says that, in fact, we warn of a respiratory pathogen that's lethal and that can actually kill millions of people and have major impact on the economy. And obviously, this was a very prescient report. And as you all know, now we're faced with the major pandemic of COVID-19. So the gpmb spent time looking at the lessons learned. And I wonder if I can have the next slide, please. So importantly, what we're showing here are some of the lessons learned, some of which are already covered by the 23 Nations report. First of all, COVID-19 revealed a collective failure to take pandemic prevention, preparedness, and response seriously and prioritize it accordingly. As we said, we live in a world that's so interconnected that we can't look at our own nation, but we need to look at everybody because a shock anywhere is a catastrophe everywhere. As been well pointed out by earlier discussion, the impact is well beyond health. It's an economic, social disruption, education, poverty, you name it. So it's really a devastating event that's affecting the world globally. And it's been said the human dimensions has been overlooked. How important is to have responsible leadership and leaders that can make decisions based on science and early decisive moves. And citizens play an important role in terms of their moral and social responsibility for the greater good. That is, protecting themselves and protecting others. And I think the 23 Nation report emphasizes really well. It's also said that measures of preparedness are not predictive in terms of how well you are doing in response to, in fact, the outbreak. I think what I want to fundamentally say is that there are some fundamental issues. You need effective agile systems, you need health system strengthening, and preparedness pandemic is a common good that affects everybody. And no one's safe until all are safe is not just simply the sum of national preparedness, the 23 nation, it actually requires consolidation and not further fragmentation. And finally, investment in global security is really, really important. And I'm going to talk about some of this in the next few minutes. Next slide, please. So I wrote a report in Lancet, a paper that says about how important it is to have strategy, coordination, and sustainable support for any response to pandemics such as COVID-19. So earlier, Stephen said about the playbook. I think we still need a playbook that's up to date, that's contemporary, that is in fact fit for purpose, and supported through trust, cohesion, and solidarity. Let's take a look at US. I think we failed miserably in many of these areas. In leadership, we lack a strong coordinated federal response. In fact, the Trump administration says states have a primary responsibility and the federal government really is a backup. Well, clearly you can see the high variability in different states without a overarching strategy and a mandate is causing tremendous problem. Politicization, forced dichotomy between economy and public health, and lack of response citizenship are some of the major problems. If you look at the slide, the bottom says we lack a national strategy coordination. It's reflected everywhere in public health measures, in testing, in digital innovation, in PPE and ventilators, in therapeutics. Perhaps the best thing is in vaccine. We do have a national strategy coordination through active and warp speed. But nevertheless, when it comes to distribution administration, there again, we don't have a clear national strategy and a good coordination. The final point in this slide says data. If you look at the UK variant, it's because UK sequenced hundreds of thousands of its infected individuals, whereas US have only sequenced 51,000. We don't have, again, a national database to bring all this information together. So for all you know, this variant could be quite pervasive, but we have not been detecting it. The middle bullet says nationalism. We have approached this from a nationalistic viewpoint. With withdrawn from WHO, we failed to engage in most global efforts, and we secure vaccines to protect our citizens. I thank them for it, but it's at the expense sometimes of global equity. For example, in June, we bought up all the remdesivir supplies, the global supply, and of course, this is not a ticket for global solidarity. Next slide. But unfortunately, in a global fashion, we also face a lack of overarching strategy and coordination. There's no entity with a mandate, with a financial arrangement, and the ability to coordinate multiple independent actors. WHO does a good job, and I take my hat off to Tedros and others for really trying hard in a very difficult circumstance. It does monitor member states, has a legal authority using the International Health Regulation, Dzau, look at preparedness, and try to coordinate when the outbreaks occur in more than one country or region. But it doesn't quite have the mandate. It doesn't have the funding, and subject to many political constraints. It does respond to emergencies like a fire department, but it has limitability. And since some sovereign state says that we don't really want you to be in our place, it can gain entry to some countries. And so it does have a lot of constraints. When you think about how to stop this pandemic, aside from public health measures, is vaccines. And here the R&D ecosystem is also fragmented because while there's basic research, there's clinical trials, there's regulatory framework, there's manufacturing, they all sit in different parts of different actors globally, and there's not a single mechanism that can bring them all together. And only a few countries like US has the end-to-end, from research all the way to procurement and delivery. Most countries don't have that capacity. So they, in fact, are unable to respond effectively during the outbreak. And of course, the big concern we have is that every country is taking care of its own citizens. Take vaccine, for example. 30% of the world population lives in rich countries, high-income countries, and so far they've pulled together over 50, 60% of all the vaccines, this idea of vaccine nationalism. So I think the global response requires everybody coming together to address equity and access. Earlier, you heard the mention of ACT Accelerator. Well, this is quite unprecedented, unusual, because back in April or May, people did come together, the actors, the heads of government, WHO, European Commission, and the actors such as CEPI, Gavi, Global Fund, and Unitate, Wellcome Trust, and others, to say, let's all work together on a voluntary basis. So it has a 2-year term with a light touch of oversight, governance, through a facilitation council and a coordination hub run by WHO, overseen by the principles of Access Radar, of which I'm one of them. You can see there are 3 pillars addressing vaccine, therapeutics, diagnostics, and health system connector. But important, this slide shows you when they come together, the idea is to cover end-to-end, from research, R&D, all the way to deployment in each one of those areas. Has big goals, trying to raise 2 billion doses by the end of 2021, 250 million courses of therapeutics, and 500 million of tests by mid-2021. Well, Accelerator has done quite well. Many of you know it's made good progress, but 2 billion doses by 2021 still covers a small part of the world's population. And COVAX, as you heard mentioned, is the vaccine pillar, which is a facility to bring together poor countries under Gavi, the AMC countries, and self-financing countries. So these self-financing countries are those which are small, rich, or middle-income countries that need to come together to create a common place for shared resources for manufacturing, procurement, etc. The good news is 190 economies that sign up. US is not part of it. And of course, the real resource country like US has to be part of this for global solidarity. Has huge amount of challenges. Financing is one of them. As we began the whole idea of reaching 2 billion doses of vaccine and therapeutics and diagnostic and others, recognize there's a lot of money needed. And really, it was really through donor assistance model, through pledges and others, that some $10 billion were raised, a little bit more, but there's still a $28 billion gap for 2021. So still large areas, so not covering, therefore, enough sufficient doses for everyone. As been said, there's an agreement on the COVAX facility that maybe 20% that will go to every country. But I showed you the next slide, that the recent vaccine availability result in many countries jumping in to make bilateral deals, some 35 nations, that's making by cornering many of the products and threatening the success of COVAX. We need multilateralism. And been said earlier by the African CDC director that doses are going to come to the low-income countries. But the concern right now, and the term vaccine apartheid is being raised because just like back in H1N1 2009, the rich countries all the doses and the poor countries have none. You're going to hear about rollout vaccines, diagnostic therapeutics. That itself needs global coordination. When you go beyond central WHO, Gavi, to the nations, how do the nations do this? Like our challenge in our country between states, and of course, equitable distribution and public trust. So I'm going to end by telling you about our 2020 GPMB report. We call it A World in Disorder. We call for urgent actions to strengthen, this is by this next slide, the response to COVID-19. And there are 5 recommendations. Next slide, please. This slide shows you the recommendations. First, of course, we all recognize, as the 23 Nations report says, really important of leadership, citizenship. But there has to be a governance, has been said, for preparedness. And I mentioned by IHR, and maybe we'll talk about this accountability panel, but NHR had to be amended because IHR, even though it's, quote, binding, it's a voluntary response and many nations are not compliant. So this has to be amended with, in fact, the ability to have accountability and able to measure externally, evaluate. We have to develop a much better international framework of governance. Every country needs strong and agile systems for health security. The heads of government need to do an all of society approach, not just health, but the rest of social protection, economics, you name it, and that we need to strengthen WHO, and of course, renew commitment to multilateral system. The 4th bullet in this slide says we really have to be prepared for research development. There has to be a sustainable mechanism like ACT Accelerator, which is only for 2 years. How do we maintain something like this to do end-to-end development and equitable access to the countermeasures? And finally, investment is so important. Because we recognize that preparedness is a global common good, and it should not be supported at the mercy of political and economic cycles. That every country must assure adequate finance in itself for preparedness, and there has to be a global mechanism for sustaining financing for global health security. My last slide, next slide, please. So what are the future needs? First, recognizing that the great work of the 23 Nation report, those are absolutely important areas to be able to move forward and learn and implement. There still has to be a strategy and coordination nationally and globally in public health interventions. And also there has to be global coordinated end-to-end R&D preparedness response. Otherwise, you won't get the vaccines and the delivery that you need. Multilateralism, as has been said, is absolutely important to allow poor countries to have global access to coordination. And if there's no global equity without solidarity. Finally, we need a strong governance structure that's clear, that can function effectively at all levels. And we need sustainable financing, where you can give long-term, predictable, reliable financing for global common good. Problem is a donor model, as we have today, is not an adequate model. You know, you need the money as you start the pandemic and not try to raise in the middle of it and using ideas of donor assistance. So there has to be a lot of work to be done. So thank you very much for asking me to reflect on this. This, in fact, is a reflection of my own as well as the GPMB. Thank you.